Hello dear students, welcome to this channel once again. So last class I have discussed about transposition of great vessels or transposition of great arteries. Now I am going to take one more cyanotic congenital heart disease, that is tricuspid atresia. Okay, let us discuss about tricuspid atresia, one more cyanotic congenital heart disease. Okay. So first definition, tricuspid atresia is a cyanotic congenital heart disease in which is characterized by congenital absence of tricuspid wall. Okay, you can see there is no tricuspid wall present in this one. Okay, so because of this, what I can say, there is no communication between the right atrium and right ventricle. So what is the definition of tricuspid atresia? Tricuspid atresia is a cyanotic congenital heart disease characterized by congenital absence of tricuspid wall, resulting in there is no communication between the right atrium and right ventricle. Okay. And one more peculiarity is that because of there is no communication between the right atrium and right ventricle, the right ventricle is not properly developed here compared to left ventricle. Left ventricle is well developed, right ventricle is underdeveloped. Okay, so this is known as tricuspid atresia. Now let us see. This tricuspid atresia may be present alone itself, or it may be associated with other congenital heart disease such as atrial septal defect, ventricular septal defect, or patent ductus arteriosus. Okay, 30% of tricuspid atresia are present with the other congenital anomalies. Now let us see what are the etiological factors. The etiological factors of tricuspid atresia. First one is the exact cause of tricuspid atresia is not known. It is not well understood or it is not known, so it is known as idiopathic. Next one is genetic or chromosomal abnormalities. So this tricuspid atresia is most commonly associated with the genetic or chromosomal abnormalities such as Turner syndrome, Klinefelter syndrome, okay, or other Down syndrome. Next one is this tricuspid atresia may be because of some teratogenic infection. When mothers suffer from any teratogenic infection during the first trimester of pregnancy, that may be because of rubella infection. So that may result into tricuspid atresia. Okay, teratogenic drugs. If mother takes any drugs during the first trimester of pregnancy, okay, so that can result into tricuspid atresia. Or there may be excessive alcoholism or smoking during pregnancy. If mother smokes heavily or takes excessive alcohol during the pregnancy, that can be the contributing factor for development of tricuspid atresia. Next is maternal insulin dependent diabetes mellitus. Maternal insulin dependent diabetes mellitus. If mother suffer from insulin dependent diabetes mellitus, which is also known as type 1 diabetes mellitus, so that can be the cause for a development of tricuspid atresia. So these are the some of the etiological factors of a tricuspid atresia. Now let us see what is the pathophysiological changes. Pathophysiology. First, due to etiological factors. So etiological factors will lead to this tricuspid atresia. Tricuspid atresia. Okay, that is a congenital absence of tricuspid wall. Congenital absence of tricuspid wall. So because of this, what happens here? There is no communication. Okay, there is no communication. No communication between right atrium and right ventricle. So because of this, what happens here? First, what happens here? Deoxygenated blood enter into the right atrium through the superior vena cava and inferior vena cava. Okay, so deoxygenated blood enters into right atrium through superior vena cava and inferior vena cava. After that, what happens here? There is no communication between the right atrium and right ventricle. So because of this, what happens here? There is a shunting of blood from right atrium to the left atrium, as there is a foramen ovale. Okay, foramen ovale is a abnormal communication between the right atrium and left atrium. That is present during the fetal life. Okay, so this will be remain existed, and the blood will start shunting from right atrium to the left atrium. Okay, so this because of this what happens here, because of this tricuspid atresia, there is a shunting of blood, shunting of deoxygenated blood, okay, from right atrium to left atrium through foramen ovale. So there is a directly shunting of blood, deoxygenated blood from right atrium to the left atrium through the foramen ovale. Now because of this what happens here, now what happens here, deoxygenated blood enters from left atrium to left ventricle, then deoxygenated blood goes to peripheral perfusion. Okay, then what happens here, there will be hypoxia and severe cyanosis. Okay, so what happens here, next what happens here, deoxygenated blood enters from left atrium to the left ventricle. Deoxygenated blood enters from left atrium to the left ventricle. Okay, next what happens here, deoxygenated blood goes to the peripheral tissue perfusion. Now what happens here, left ventricle contraction takes place, and this deoxygenated blood through the aorta, it will go for the peripheral tissue perfusion. Okay, there is no oxygenation happens here. So because of this what happens here, there will be severe hypoxia. Hypoxia leads to severe cyanosis. Okay, so this is a pathophysiology of tricuspid atresia if it is existed alone. Okay, now let us see what is the pathophysiology of tricuspid atresia if it is associated with the other congenital anomalies. So due to etiological factors, okay, that is a tricuspid, it will lead to tricuspid atresia. So this tricuspid, okay, tricuspid atresia, so tricuspid atresia associated, if it is associated with other congenital anomalies. Okay, other congenital anomalies may be atrial septal defect, okay, patent ductus arteriosus, ventricular septal defect. Okay, ventricular septal defect. So other side of pathophysiology of this tricuspid atresia. Okay, due to etiological factors, there is a tricuspid atresia. If this tricuspid atresia is associated with other congenital heart disease like a atrial septal defect, patent ductus arteriosus, and ventricular septal defect. So in that condition, what is the pathophysiology we will discuss. Okay, so we will discuss one by one. So due to etiological factors, there is a tricuspid atresia, and if it is associated with the atrial septal defect. Okay, so if it is associated with the atrial septal defect, what happens here? The deoxygenated blood enter into the right atrium through the superior vena cava and inferior vena cava. Then, because of presence of this atrial septal defect, there is a abnormal opening. There is abnormal opening is present between the abnormal opening is present between the right atrium and left atrium. Okay. So if this tricuspid atresia is associated with atrial septal defect, there is an abnormal opening between the right atrium and left atrium. So because of this, what happens here, there is a direct shunting of blood from right atrium to the left atrium. Okay, so there will be shunting. So because of this, there will be shunting of blood from right atrium to left atrium. Okay, then what happens here? On contraction of right atrium, blood will move from the left atrium to the left ventricle. On contraction of left atrium, blood will move from left atrium to the left ventricle. Okay, so blood moves from left atrium to left ventricle. Then what happens after the contraction of left ventricle? The deoxygenated blood directly go to the peripheral tissues through the aorta without any oxygenation. Okay, so on contact. Okay, next what happens here? Deoxygenated blood goes for peripheral tissue perfusion. Okay, through aorta. So this will lead to what happens here? Hypoxia. This will lead to hypoxia, and finally it will lead to severe cyanosis. So this is the pathophysiology of tricuspid atresia associated with the atrial septal defect. So due to etiological factor, there is tricuspid atresia. Because of this, there is a atrial septal defect. Okay. Then there is a shunting of blood from right atrium to the left atrium through this defect. There is shunting of blood from right atrium to the left atrium. Then blood moves from left atrium to the left ventricle. Deoxygenated blood moves from left atrium to the left ventricle. Then deoxygenated blood go for a peripheral tissue perfusion. So left ventricle contraction will take place, and deoxygenated blood go for the peripheral tissue perfusion through the aorta, and there will be severe cyanosis. Why there is a severe cyanosis? Because of hypoxia, as there is no oxygenation. Oxygenation of blood will not at all take place here. So because of this, what happens here? Directly the deoxygenated blood will go for the peripheral tissue perfusion. So this will lead to severe hypoxia. So that will lead to severe cyanosis. Okay, so that is why it is classified under the cyanotic congenital heart disease. Now let us see what is the pathophysiological changes if this tricuspid atresia is present with a patent ductus arteriosus. Okay, so due to etiological factor, there is a tricuspid atresia if it is associated with patent ductus arteriosus. Okay, that is a abnormal opening between the aorta and pulmonary artery. Okay, for example, take an example. If there is a abnormal opening, so here is a abnormal opening. Okay, so this is a PD, patent ductus arteriosus. Okay, abnormal opening. What is patent ductus arteriosus? Abnormal communication between the aorta and pulmonary artery. So this is a patent ductus arteriosus. So due to etiological factors, there is tricuspid atresia. If tricuspid atresia is associated with the patent ductus arteriosus. So because of this, what happens here? First there will be shunting of blood. Okay, there is a shunting of blood from right atrium to the left atrium through the foramen ovale. Okay, then blood will enter into the left atrium to the left ventricle. Okay, then on contraction of left ventricle, blood will move to through the aorta. Blood will go through the aorta. And here what happens here? There is a shunting. Okay, there is a shunting of deoxygenated blood. Shunting of deoxygenated blood from aorta to pulmonary artery. From aorta to pulmonary artery through patent ductus arteriosus. So here what happens, sir? After the contraction of left ventricle, the deoxygenated blood moves into the aorta. Then what happens here? The pressure of deoxygenated blood in the aorta is higher than the pulmonary artery. So because of this, there is shunting of blood from the deoxygenated blood will be shunt from high pressure in the aorta to the low pressure in the pulmonary artery. So because of this, what happens here? There is an increase. There is increase pulmonary blood flow. Okay. And because of this, what happens here? There is a oxygen. Some oxygenation of blood will take place. Okay. Oxygenation of blood will take place. Then what happens here? So there is shunting of blood from aorta to the pulmonary artery. Then there is increased pulmonary flow, increased blood flow to the lungs for oxygenation. Then oxygenated blood will come. Okay. Then what happens here? Oxygenated blood. Okay, oxygenated blood comes to left atrium through pulmonary veins. Okay, so after the oxygenated blood comes to left atrium through this pulmonary veins. Through this pulmonary veins, the oxygenated blood comes to left atrium. Okay, then what happens here? There is a blood moves. Okay, this oxygenated blood moves from left atrium to left ventricle, and then on contraction of left ventricle, oxygenated blood, okay, this oxygenated blood goes for peripheral tissue perfusion. So because of this, what happens here? There is some improvement in the oxygen. There is a oxygenation of peripheral tissue, and cyanosis will be less severe. Okay, cyanosis will be less severe. Okay, compared to only condition of tricuspid atresia, the cyanosis is very severe. But here, because of tricuspid atresia is present with the patent ductus arteriosus, some amount of blood go for the peripheral, some amount of blood go for the pulmonary blood flow will be there. So because of this, what happens here? There is oxygenation blood take place, and oxygenated blood come to the left atrium and left ventricle, and there is a good oxygenation of blood. Some amount of oxygenation of blood will be received by the peripheral tissues. Okay. So what is the pathophysiology of this one? So due to etiological factors, there is a patent ductus arteriosus. So first, what happens here? The deoxygenated blood enter into the right atrium through the superior vena cava and inferior vena cava. Then deoxygenated blood enter from right atrium to the left atrium through the foramen ovale. On contraction of left atrium, deoxygenated blood enter into the left ventricle. Then on contraction of left ventricle, deoxygenated blood directly enter into the aorta. So because of presence of this patent ductus arteriosus, what happens here? The deoxygenated blood, okay, which is present in the aorta will shift from aorta to the pulmonary artery because of pressure gradient. There is high pressure in the aorta, low pressure in the pulmonary artery. So because of this, what happens here? There is increased pulmonary blood. Okay, so increased pulmonary blood flow. So increased oxygenation of blood will take place. Then oxygenated blood. Okay, so this oxygenated blood enter into the left atrium through the pulmonary vein. Then this oxygenated blood will enter from left atrium to the left ventricle. Okay, on contraction of left ventricle, so again the blood will, here the oxygenated blood will go for the peripheral tissue perfusion. So because of this, the hypoxia will be less. Okay, there will be oxygenation of peripheral tissues, and cyanosis will be less severe compared to the only tricuspid atresia condition. Okay, now let us see third associated factors. So due to etiological factors, there is a tricuspid atresia. Okay, if it is associated with ventricular septal defect. Okay, so if it is associated with ventricular septal defect is nothing but there is an abnormal opening between the right ventricle and left ventricle. So because of this, what happens here? First, the deoxygenated blood present in the right atrium sends to left atrium through the foramen ovale, then it will enter into the left ventricle. So because of this, what happens here? The pressure and volume in the left ventricle is more than the right ventricle. As there is no blood flow to the right ventricle, there is no pressure and volume of blood here. So the pressure and volume in the left ventricle is more than the right ventricle. So because of this, there is a shunting of blood from left ventricle to the right ventricle. Then what happens here? On contraction of right ventricle, the blood will go for the lungs. Deoxygenated blood go to the lungs for the oxygenation. So then what happens here? There is oxygenation blood will take place, and oxygenated blood again comes to the left atrium through the pulmonary veins. Then this oxygenated blood will enter into the left ventricle, and on contraction of left ventricle, the oxygenation, some amount of oxygenation of oxygenated blood will go to the peripheral tissue perfusion, and because of presence of this ventricular septal defect, there is a less cyanosis because there is the improvement in oxygenation. Okay, so etiological factors will lead to tricuspid atresia, that is ventricular septal defect. So because of this, what happens here? There is a shunting of blood. Okay, there is a shunting of deoxygenated blood from high pressure in left ventricle to low pressure in right ventricle. So because of this, what happens here? There is increase. Okay, there is increased pulmonary blood flow. Increased pulmonary blood flow. Okay, so because of this, what happens here? There is a oxygenated. Okay, oxygenation of blood will take place. Oxygenation of blood takes place. Okay. So because of etiological factors, there is a tricuspid atresia. It is associated with ventricular septal defect. So because of this, what happens here? Because of ventricular septal defects, okay, there is shunting of blood from left ventricle to the right ventricle because of high pressure in the left ventricle. Okay, so there is shunting of deoxygenated blood from high pressure in the left ventricle to the low pressure in the right ventricle. And because of the blood is entering from left ventricle to the right ventricle on contraction of right ventricle, there is increased pulmonary blood flow. So this will lead to oxygenation of blood will take place. Okay. Next, what happens here? Then oxygenated blood enters into left atrium through pulmonary veins. Okay, so oxygenated blood enters into left atrium through the pulmonary veins. Then oxygenated blood moves from left atrium to left ventricle. After this, on contraction of blood, okay, on contraction of left ventricle, okay, some oxygenated blood goes for a peripheral tissue perfusion. Okay, so this will lead to decrease hypoxia. Okay, decrease hypoxia and less severe cyanosis. Okay, less severe cyanosis. Okay, so what happens here? After the oxygenation, the oxygenated blood enters into the left atrium through the pulmonary. Okay, after the oxygenation, the oxygenated blood enter into the left atrium through the pulmonary veins. Then this oxygenated blood will enter into the left atrium to the left ventricle. On contraction of left ventricle, this oxygenated blood go for the peripheral tissue perfusion. Okay, so oxygenated blood goes for peripheral tissue perfusion. So this will lead to decrease hypoxia and severity of cyanosis also decreases. Okay, so if tricuspid atresia is associated with the patent ductus arteriosus and ventricular septal defect, then the cyanosis will be less severe because there is an increased pulmonary blood flow. Either because of this defect or because of this defect, there is a shunting of blood from left ventricle to the right ventricle, and that will lead to increased pulmonary blood flow. Because of this PDA, there is a shunting of deoxygenated blood from high pressure in the aorta to the low pressure in the pulmonary artery. So because of this, there is an increased pulmonary blood flow. So as the pulmonary blood flow increases, the oxygenation of blood will take place, and oxygenated blood will enter into the left side of the heart, and contraction of left ventricle, there is a oxygenated blood will go for the peripheral tissue perfusion. So because of this, the hypoxia severity will be less and cyanosis is also less severe. So this is all about the pathophysiology of tricuspid atresia. Okay. Now let us see what is the clinical manifestation. Clinical manifestation are, first one is severe cyanosis. This severe cyanosis appears soon after the birth of the baby. Okay, because of there is no proper oxygenation of blood. And next one will, what is there? There will be dyspnea, difficulty in breathing, tachypnea. Okay, tachypnea is increased respiration rate. Then tachycardia, increased pulse rate, respiration rate, increased pulse rate. Then what happens here? There will be mental slowness. It is because of decreased oxygen supply to the brain. Okay. Other manifestations are restlessness, lethargy, confusion, So this mental slowness, restlessness, lethargy, confusion, all these are because of a decreased oxygen supply to the brain cells. Then other manifestations are activity intolerance. Activity intolerance, because all our body activity requires a continuous supply of oxygen. Okay, if there is no proper oxygenation, then activity, the child will not tolerate the activities. Okay, then failure to thrive. Failure to thrive, the baby will not have optimum achievement of height and weight. Okay, next one is clubbing of finger. Clubbing of fingers. So the distal part of the fingers are abnormally dilated. It is because of hypoxia. Okay, because of there is no proper oxygenation. Okay, so these are the manifestation of a tricuspid atresia. Okay, so there will be most significantly there will be severe cyanosis, bluish discoloration of the skin, nail, tongue, and lips will be there. So that is a significant in case of tricuspid atresia. So this is all about the clinical manifestation. In next class video, we will discuss about the diagnostic evaluation and management of tricuspid atresia.